All right, ladies and gentlemen, welcome to CCN News Media Broadcast. We're going to talk about the condition of the COVID-19 today, how we're faring with that. I mean, I woke up this morning and heard your president, not mine, talking about he did an excellent job, and he just doesn't understand why others don't agree with him.
We want to end with playing one of the key sound bites of the morning. President Trump yesterday blaming blue states for the country's coronavirus death toll.
The blue states had tremendous death rates. If you take the blue states out, we're at a level that I don't think anybody in the world would be at. We're really at a very low level, but some of the states, they were blue states and blue state managers.
The president's comments come just one day after he tried to distance himself from Democratic-run states at a town hall in Philadelphia.
What they want is a bailout of Democrat-run states that are doing poorly. And, you know, I don't think this is the right way.
Why do you keep talking about Democrat states and Democrat states? They're American states and American states.
Democrat-run states are the ones that are doing badly, George. If you look at New York, if you look at Illinois, if you look at a lot of different places, they're doing poorly. And cities, in particular cities. I mean, these cities are being run so poorly.
But don't you have a responsibility for those states and cities as well?
Debt, but largely because of the crime. They don't want to do anything about crime. Sanctuary cities, they have sanctuary cities where they're protecting criminals. They have things that the Republicans don't have. So they are. I mean, I don't want to say, look, I'm the president of everybody, but I don't want to say it, but they're Democrat-run cities. It is what it is.
The president left all 50 states in a lurch, leaving it up to the governors. 50 different states, 50 different strategies. Wes Moore, no mobilization of the Defense Production Act, no national strategy. And he continues to lie about this virus. And you have cult members, whether they be in the media or voters in America who have been misled by this man, who are following him blindly. It's becoming frightening, not only for these people's lives, but for the sanctity of our democracy.
Well, this is a perfect example that leadership matters and truth matters, because what we heard just now is not truth. You know, the economic fallout from this pandemic has left states with an estimated $555 billion shortfall in the next two fiscal years through 2022. You know, the states and the cities are able to do and are leading as best as they can, considering the fact that the federal government has not provided resources to them in order to help to lead on this issue. Leadership matters and truth matters in this.
Wes Moore, always so great to have your perspective on the show with us. Great to see you, Wes. Thanks so much. You know, Mika, we got a snapshot of the way this administration views the country this morning with those sound bites you played, which is from the president's point of view. If it weren't for those blue states, New York, New Jersey, California, and all those deaths, his numbers on coronavirus would look much better. And from the Attorney General, Bill Barr, we heard that national lockdowns, as he called it, which we don't have, are an infringement on personal liberty in this country and not a way to get us through this crisis. That's how they look at it.
Yeah, I don't think his followers and also those who are parroting his lies on television understand the implications. And if they do, that's a whole different story.
Thanks for checking out MSNBC on YouTube. And make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.
Although he did say that there are a few people that do agree with him, but he doesn't understand why the majority of us don't agree with him, because he's done a wonderful job. What say you, anybody? What do you think about the situation with COVID-19 today? I know I've been in for a while. I go out and do what I have to do, but I'm always wearing my face mask and my gloves. And what about you? What are you all seeing out there in the world today?
Well, this is Deborah. Before I take my nap. Yes, I did listen to Dr. Trump this morning.
Did you?
Yes, I heard what he said. I always try to listen to what he says because I don't want to preassume what somebody might tell me he said.
Right.
like to hear
Yourself.
from the source. And that's
Yes.
something that us in the media need to pay more special attention to, instead of listening to hearsay.
Yeah.
When we hear the hearsay, it's okay to follow up on it and get the facts before we repeat it,
Right.
because it's so much untruths and misrepresentation
Oh yeah.
through our not necessarily our organization, but our industry, through
Yes.
the media, that we want to pride ourselves on being correct. Uh, so this, I think that it is just, I've come to the realization that this is just a virus that is in heightened with uh, circumstances where it's you just can catch it easily. And so you
Right.
have to take precautions that you would take with any other virus or sickness. Uh, Cleanliness, staying away, and being aware. Now, I am also in the travel industry, and I haven't had a vacation or traveled in over a year. Uh, so I was at a point where I was stir crazy. But I took one for the team, and I got on an airplane a couple of weeks ago. And things are different. I even stayed at a hotel when I traveled. Things are very different. And one of the situations that we have to pay attention, even in life, we have to be patient. We have to know that what we did before the normal, there is no going back to that. It's all a challenge, it's all different, and we have to adapt accordingly. So don't hold yourself in. I still talk to people who are still getting their groceries delivered, still seeing the doctor through video chat, and just not venturing outside, and staying indoors is just as bad a detriment as it would be going outdoors, because you need that fresh air, you need to get around, you need that sunlight, that atmosphere, because you can stick in the house and get sick just being in the house. So
Absolutely. I mean, I did my doctor's appointment through Zoom as well. The nurse came on and interviewed me, but everything seems like it's changed so much, and most things are being done from home. I was talking to Sandra earlier, and she was saying that most of the government workers are working from home, and you know, that's a new way of doing things today, and it's kind of like the dissertation I was doing was on helping people, seniors and disabled adults specifically, to use the internet to learn how to surf and pay their bills and do their banking and shop. And now all that's happening today. So it's almost like that was a forthcoming. Hey, let's see what happens. I think this is a new wave. I think this is the way things are going to be for a while. I don't think we're going back to the shopping malls and all that stuff, although those things are still going to be open and you'll still have access to them. But I think more people are going to be doing the online remote kind of thing for most of their needs. What say you?
Hi, Wanda. This is Sandra. You know what?
Sandra.
Hi, Deborah. To chime in on what Deborah was saying with regard to people going out and, getting some fresh air and sunshine sometimes, I think that was reiterated early on. Again, you can go out in your backyard. You can go out in your front yard, I think concerts at night, people in those really tall high rises were coming out on their individual balconies at night, and they were all joining in for a type of song that was being performed by one of our famous performers that's being streamed, and everyone was participating. Mm. That kind of going out you can do. And again, one thing that we do, we have our, I guess we call them our little pods This is a group of us who are safe, and it's family. I mean, they know that we're not taking any risks or doing anything crazy. And we might get together, and again, it's a small group. It comes to be maybe 9 of us sometimes. And we might get together and barbecue or do something just to see each other. You know, and the kids go down the street. There's a big garden that Jill has on the end of her block. It's like actually 3 or 4 lots that's maintained. It has a bench there, and they grow vegetables and whatnot. But the kids can go down there and they can actually run and play and get off some steam. Well, we only got one little kid, but the big kids will play water balloons or something with them. But I think the problem that they're talking about that's making this so crazy is the things that the college students are doing with these big parties, the things that they did in Vegas last week. Everybody in the world is talking about.
What did they do?
Oh my God, there were so many of them out on the strip and it was just, they were shoulder to shoulder. No one had on masks, and it was just reckless. And I think the thing that a lot of people don't understand, and I see more of that is being promoted in the media, even if you are asymptomatic, and there are a lot of asymptomatic individuals, those individuals are dangerous. They're dangerous because they're asymptomatic, and they're usually the main ones that don't want to wear a mask, or they want to go from house to house to house, and they say some ridiculous statement about COVID is not for me, or I'm not. It's something really sheerly ignorant. And what they don't realize is that you wind up exposing other people who are not asymptomatic. And because you don't know how this virus is going to affect you, and what after effects or lingering effects those individuals may have, it makes it very dangerous. And 200,000 people to be sick is to die. That's nothing to shake the laugh about. 200,000 people in 6 months. That's a lot of people. And the fact that the Dr. Fauci has to come out and say, we are not taking this serious enough. I mean, and the fact that it's going to get worse as we really go into the flu season. He said is not good.
He said that we should be at 1/10 of where we're at with the volume of people that are contracting the disease and the volume of people that are dying. Today, we have, 6,825,000. Oh, maybe I'm not even reading this right. I think it's 6,825,697 total cases. USA,
Thus far.
That's USA.
Thus far.
Thus far.
People who have been tested. There's so many millions of people.
Those are the ones that have been tested. Right.
Have not been tested.
Right.
And I don't want to get tested.
Me either. I don't want to get tested either because, I know my ex-husband is still in recovery he's a veteran, and he got COVID. He went to Jules, and a woman coughed in his face, and he got that virus, and it took him all the way down. They did not think he was going to make it. And Sandra, I found out just recently after talking to him that he said that his case was the first case at that VA that was he went all the way down. He had to be on a ventilator. He was in ICU. They didn't think he was going to make it, the whole bit. And he was there for 3 months, and now he's in a rehabilitation center because he has to learn how to walk all over again. And I talked to him on the phone, and he sounds like he can barely speak.
They can. My sister is going
through the respiratory. It attacks the respiratory system, and then it turns around and it proceeds to go to other areas of your body that you are not aware of that are vulnerable, and it attacks it if it can.
My sister is a 3-time cancer survivor.
Oh my
goodness. Said, you do not want this. She's in therapy 3 times a day. She finally is in a position where she's at home.
Wow.
But she walks around with her oxygen, the
Wow.
little bit that she can. She, it's hard for her to speak on a
Yes.
regular basis.
Right.
And her lungs, it just damaged her lungs.
Yes.
Where she was on a ventilator and she's been suffering since March.
It's the same with him. He's been suffering since March. Now, both my son, that's a nurse in California, and my daughter, that's a hospital administrator here in Chicago, both of them got COVID. And both of them, my son had the, because he's a nurse, he had to do that 14-day thing. And then he went back to work and they tested him again. He still had it. So he had to take off another 14 days. And then he went back to work and they tested him and it was gone. So they let him return, but he had to stay in a restricted area. He has to wear that garb, Sandy, you know what I'm talking about. They have to wear the protective
isolation of suit. Yes. Isolation suit.
Right. Yeah. They have to wear that with the mask and the gloves and all that stuff. And he said it's hard to work all day and all that stuff.
Yeah.
All day and all that stuff. Can you imagine how the patient feel walking up to them looking like a space cadet?
Can I ask why you guys said you don't want to be tested? Why is that? This is Jillian.
I don't want to be close.
I don't
want to be tested. No. I know one thing for me, that I have learned: psychological effects bring about a lot of challenges. And when somebody tells you got something, that enhances the thought process and deteriorates you more. And I know I've been a victim of that thought process myself, even though I feel as though I'm strong. But if they tell me I got COVID, then I'm going to think COVID. Right now, I'm telling me that I just protect myself. I know how my body is reacting to different challenges. I have allergies. So I know the difference in an allergy and a cold. I know when my sugar is up.
Yeah.
And, I know how.
You know how to assess yourself.
Now, if I find that I have a challenge that I am unaware of and don't feel comfortable with, and if I feel as though, okay, now is the time for me to go in, I will go in.
Yeah.
But just to go to see,
I feel the same way. I've been to the doctor several times since this COVID-19, but I'm not going for them to do that test. Whenever I go to visit the doctor, they always take your temperature. They always ask you 1,000 questions, and they always do the vitals. But as far as them doing some kind of swab where they sticking something up your nose so far that it can come out your mouth, no, I ain't going through that crap.
And you know what? You should be doing that to yourself every day anyway.
Doing what to yourself?
Taking your vitals.
Oh, I do my vitals.
Yeah, your blood pressure, your oxygen level, your temperature, your weight. You should register that on a regular basis for yourself anyway.
That makes sense. So what say anybody else about COVID-19? What do you think the future has in store for us? I mean, according to Dr. what's his name? Fauci? How you say his name?
Fauci.
He said this morning that by January we were going to have another 200,000 deaths.
I believe since he was one of the original ones that stirred that pot up a few years ago anyway.
Yeah. You guys remember? Do you all remember Elizabeth?
Yeah.
Okay, so she called me this morning. Well, actually, she called me yesterday morning, but she called back this morning. Somebody's in prison, and they have COVID-19, and the prison is aware of it, and they're doing nothing, and it's infecting other prisoners, because I think she said there was like 9 people in a cage or something. It's some phenomenal number that she said that so many people are in this cell together. And I was like, what? And they got COVID-19. I said, so she wanted to know what, what route she could take. I said, you know what? All I can tell you is let's do a discussion on it, and I'll send the recording to the governor's office. I mean, what else? I mean, if the prison knows that those folks, somebody in there got COVID-19, and they're not doing anything to separate those people.
Well, here's something that, going back to the first conversation we had. We being in the position that we're in, we got to get the facts.
I'm sorry.
We have to get the facts.
Yes.
Before we go off and on a tirade and do whatever we can do, but we have to get the facts. And hopefully Elizabeth is in a position where she can get the facts.
Well, she's gonna be trying. I guess whoever this is somebody.
It's really two major steps I would have done before I called anybody else. I would have called the prison. You cannot get into the prison, but however, you can make that call. That would be the first call. The second call, I'll call the local police, and then I'll call a radio station.
See?
It may be hearsay, it may be factual, but if you make at least a couple of calls to some people that's in higher security, they can make some calls. That's what I would do.
Okay.
I've had people in the system, and I've called directly and just told them exactly the information that I received, not the person, but the information I received, and then let them know that I'm calling the local police and I'm calling the local radio station. I mean the news station, and see what we can come up with. I'm sure you can call the border. Yeah.
Well, she said she's gonna call me tomorrow and let me know whoever it is.
And she might want to also check with the ACLU and possibly the Illinois Prison Review Board, because some aspects of those entities, again, if your civil rights are being violated,
right? And
I think you have to keep you safe even while you're incarcerated. Even though they're incarcerated, they still have rights.
Exactly.
And to be healthy, be able to stay alive, I think is one of the basic rights. So to contact those kind of groups, she can have a choice there. And they can also, if they can't help her, they can probably, pass it on and tell her whom else she might be able to contact.
So who should she contact?
News, though. But Wanda, that isn't news. They had a very similar situation with Cook County.
Oh, really?
I mean, there's a situation with Cook County in the onset earlier this year. It continues to be a problem in the jail, and not only the jail here, but jails everywhere.
Oh, wow.
Because of the fact that it's impossible to do social distancing when you are being held for crime or held over for court or whatever it is. That is something they still have not figured out. I heard way back in May, I think it was, where some place and some other places, they were people who were not, don't want to say weren't serious crimes, because it was serious enough to get you incarcerated or in prison, to be in jail for more than a year, you go to a prison. If it was serious enough for that to occur, it had to be serious. But in their institution, in their world, they're saying those who have not, they don't have really serious crimes, they're shortening their time, and they are taking measures to release them so that they don't get caught, they don't contract COVID-19. So, I mean, it isn't new and it is a problem.
Yeah.
Like people with their bonds and whatnot, they want to make sure that they actually ask in bond court, what can you pay? And whatever the prisoner state, the judge pretty much gave them that. If it was $25, $50, whatever they stated, they allowed them to utilize that amount and bond out.
Oh, wow.
For the session that
But also, what I know from some people, I know that families that had to actually, the outside families had to fight. And I mean, it took some months,
Yeah.
But some of them did get their loved ones out, but they had to be diligent, stay on it,
Okay.
call the prison multiple times, get health documentation, because they were asthmatic, some had other issues, diabetes, and they were high risk.
Wow.
And they actually had to really fight. Like it took months, but they were able to ultimately get their loved ones home, even if it was on one case I know he came home on house arrest.
Oh wow.
So
and I think that's probably what they're gonna do to a lot of them, because it I think who was that just saying that they were letting, if it wasn't a serious, I guess maybe it didn't murder somebody or harm somebody, they'll let them out on an ankle bracelet.
Yeah, because it wasn't even just the issue with the prisoners. It was with the correctional officers also. So many correctional officers have tested positive for COVID, and more than we know, because I do know people that work for the county, more than we know that's being divulged to us, because they're trying to keep it on a hush, but they have concerns about it. The probation officers, the correctional officers, all of them that are coming in and out have an issue with this also.
Yeah.
It's not controlled at all.
Oh wow, that's horrible.
Because both Rose and Sons work for county. They work over there.
Okay.
And so that is those guards are very, very worried and concerned. But however, Wanda, when you talk back to, I would call Elizabeth back, because at her church they have probably one of the largest prison ministries in the state.
Really?
That's her
what church is that?
That's Reverend Meek's church.
Oh, and they got a prison ministry?
They got a huge prison ministry. So she should have, I would have made those calls. Even now, I would have made the call to the church. I would have still made all those same calls right now. Why wait till tomorrow?
Okay.
She can put all the calls in. At least she'll be able to sleep, that she didn't transfer the information as far as she could take it.
Right.
Call the church. Right. Make all those calls tonight, because even when you call it into the prison, you're still going to go probably just like anything else. You're going to go on a recorder, or somebody may pick up the phone. But if you call the police station in that county or wherever they are, the police station got everything is recorded. So it's all for her.
Okay.
And keep your document records. Times and the dates and who you spoke to.
Okay. Well, guys, thank you for the advice. I will definitely call her and give her that feedback.